Has suggested Michigan could see its peak of COVID-19 cases in a matter of days, but the state is following its own models, suggesting it could come at the end of April or beginning of May. The state legislature, as we mentioned, convenes tomorrow to consider extending the governor's emergency declaration.
Well, as the pandemic ravages southeast Michigan, medical leaders are calling on the state to do more to help spread out patients across the hospital system. 7
investigator Heather Catallo joins us live with their growing concerns tonight. Heather?
Yes, as the surge of cases continues across our region, both frontline nurses and hospital leadership are getting more and more vocal about what they need from the state.
As deaths from COVID-19 continue to climb in Michigan, healthcare workers at all levels are calling for help.
We're told to leave because we refuse to accept unsafe staffing, unsafe patient load.
25 patients to one nurse.
These nurses from Sinai Grace Hospital used Facebook Live overnight as they left the hospital, alleging their working conditions were unsafe. Hospital officials say other nurses stepped in to help care for patients. Meanwhile, Beaumont Health CEO John Fox is calling for better coordination between the state and other hospitals.
The goal is to get the patient treated faster in a more timely way, obviously in a clinically appropriate way, and not have to wait.
Fox told CNN he wants more real-time data from the state so that when Beaumont ERs get inundated, they can safely send coronavirus patients to other hospitals.
Because with these patients, when they're presenting with their respiratory issues related to COVID-19, there's a shot clock out there where they're going to continue to deteriorate unless they start to get therapy relatively quickly.
We are trying to determine who can take COVID patients or non-COVID patients, and encouraging direct communication between those hospitals.
Ruth Ann Sutterth is with the Michigan Health and Hospital Association. She says the MHA is helping its members work with the state so patient care and personal protective equipment can be coordinated.
We're encouraging to report that daily by the same time every day so that as they check that and send resources out to hospitals, that it's as real time as possible.
Beaumont has also issued a new policy for its all-hands-on-deck approach to the pandemic. While dozens of healthcare workers have voluntarily come out of retirement to help on the front lines, other current nurses and doctors will have to be redeployed to work with COVID-19 patients. Staff with legitimate health concerns can refuse the reassignment, but for others, the policy states if they choose not to accept redeployment, they will be considered to have voluntarily resigned from employment and will not be eligible for future reemployment.
I can't tell you how much we appreciate them putting themselves on the front line of this battle, because it is a battle. We are doing everything we can to make sure you are safe and healthy, because what you're doing is nothing short of heroic, and we just so appreciate it.
I did reach out to the state about their real-time reporting system. They say all the hospitals have access to it, but they do admit not all hospitals are reporting the data as they should be. They're trying to put some things into place this week to improve that so everyone can have that real-time information about which places have beds open so patients can get treated more quickly. Reporting live, I'm Heather Catallo, 7 Action News.
So important for them all to work together so we can get through this. Thank you so much for the live report.